Now, we're going to turn to the story the Prime Minister had hoped we would focus on today. NHS England is investing £1 billion in a 2-year plan aimed at cutting A&E waiting times.
The new strategy includes a fleet of new ambulances and thousands more beds, but there are concerns the investment won't reach the heart of the issues facing the NHS, as our health correspondent Catherine Jones can tell us.
Oh, right. Hi. How are you? Oh, actually nice to see you.
He knows the state of the health service is one of the public's biggest concerns. So today, the Prime Minister has made some big promises to make things better.
If we can deliver on it, then I think we will see, in fact I know we will see, the largest and fastest ever improvement in emergency waiting times in the NHS's history.
Matthew has seen how bad things have got. After a fall, his mum Jackie waited 11 hours for an ambulance. She died 2 days later.
And all she kept saying to me was, Matthew, when is help going to come? Now, I appreciate that she was breathing and therefore she wasn't a very urgent case, but surely we shouldn't be in a situation where someone who is 78 years old and frail and scared should be left in a situation where help doesn't arrive for 11 hours.
To cut delays like that, England will get 800 new ambulances and 5,000 more hospital beds, plus NHS 111 gets a boost. But there's also money to do things differently. So the University Hospital of North Tees uses tech to track delays discharging patients.
Myself as manager can come in and say, why is that patient waiting 3 days? And we can automatically do something.
And people are also put on virtual wards. They're actually at home, monitored remotely by doctors with staff visiting only when needed.
Whereas in the past someone might have been in the hospital for 3 doses of antibiotics over the course of the day, if through what's called the virtual wards, the hospital at home were able to treat them with our antibiotics in their home setting, that's a much better experience for the patient.
Very nice to see you all.
What may jeopardise this plan is finding the staff. Plenty may line the corridor for a prime ministerial visit, but England's NHS currently has 130,000 vacancies to fill.
Lots of the people engaged in delivering urgent and emergency care are trying to cover some of those vacancies. So that really makes things challenging, and we need a proper workforce plan to make this sustainable in the future.
And right now, Rishi Sunak has another problem, don't forget.
When are you actually going to pay nurses properly?
Of course I want to be able to do that.
He wants to, but he hasn't. A tricky position when much of this ambitious plan will rely on the goodwill of an exhausted workforce.
Well, our health correspondent, Catherine Jones, join us now. Cathy, it sounds like a really bold plan, but the big question, the obvious question is it really going to work?
I think there is an awful lot in this that is already working and that are really exciting ideas. So if you can imagine, your grandma falls at home and a paramedic turns up with a district nurse or a community nurse, and then they FaceTime the doctor at the hospital and between them work out how to keep her at home and not cart her off to hospital. It's everybody wins, win-win situation. But I'm now going to list all those things that I bang on about all the time. Sorry to bore you both, but I'm afraid to say staffing, as I mentioned, GPs in crisis, crumbling hospitals, and most of all, a social care sector that is struggling so badly. Add into that a workforce who are in the middle of an escalating industrial dispute, and all the reasons that this blueprint is desperately needed are also all the reasons why it is probably going to struggle to meet all its aims. But I applaud them for trying.
You're never boring, by the way, never.
Thank you, Cathy. And if you're after more analysis on the crisis in the NHS, you can check out our podcast. It's called How Did We Get Here? With our political editor, Andy Bell. And this week he chatted to Alan Milburn, a former health secretary during the Blair government, about how to fix the health service still feeling the impact of the COVID-19 pandemic, together with those chronic staff shortages, long waiting times and the recent wave of strike action that Catherine's been talking about.